Hello, everyone. Welcome to Lunch for the Soul. Oh, I love having you here with me. This is a time for us to reflect and talk about faith over fear a lot of the times, but just how some people overcome and use a lot of faith along the way and have a lot of help along the way as well. I feel like we can all learn from each other during these segments. So it just means a lot that you're here. I'm doing things a little differently this week. A lot of times, we tell you stories from the patient's point of view of what they've been through, of how difficult a time perhaps they've been through and how they use that faith to get them through. This time we're switching it up and you're going to hear the doctor's perspective of it. How about that? And also a chaplain's perspective about how they're able to help not only patients, but healthcare workers as well. So just stick around with me for about the next 20 minutes or so. And we have incredible guests to introduce you to, starting with, let's bring in right now, Dr. Sriram Nathan from Memorial Hermann and UTHealth. Welcome to Lunch for the Soul.
Thank you so much for having me.
I can't tell you how happy I am to have you with me right now. And I'm going to show everybody what we're going to be talking about today. It's a dramatic story that you were in the middle of. And here we go. So we are going to be talking today about Frank and Timeka Eakins and what a story they have to share. So why don't you start by telling us, first of all, about some serious health problems that he went through. But I want everyone to know that this leads up to their wedding day that this amazing doctor right here made happen. So Frank started early in life in his 30s with congestive heart failure, and you've been able to help him along the way?
Yes, he came to us approximately a year and a half ago. He had come in with multiple times to the hospital with heart failure, not able to come out of the hospital because of fluid buildup and shortness of breath, and he was not able to carry out activities of daily living. So one of those admissions, because of his recurrent hospitalizations, despite being on optimal medical therapy, they kind of said, this is time to get some of the heart failure physicians to take a look at him and see what can be done for him. And when
And
I saw,
oh, go ahead.
when I saw him, obviously he had a lot of fluid and he was in extreme distress. He was short on breath and was not able to carry out even a sentence without stopping because of being short on breath.
And so let's lead up to what happened. So you knew that he was planning his wedding. He had to delay his engagement because of some medical problems. And you knew this along the way, right? So you knew where it was building, where his future was headed, and how much that meant to him.
Exactly. So the process, what he went through is what is called advanced heart failure treatment. So because his own heart was not doing much, he needed some additional help. And so he had to go through a formal medical review board to kind of say that he's reached a point in time where his heart needed additional help. And he went through what we call a left ventricular assist device, which is an heart pump, which was implanted into his heart so that it could help him to take care of his congestive heart failure.
And
And
then we lead up to what happened on his wedding day. My goodness, he also had an implantable defibrillator that took care of some serious business on the morning of his wedding, right?
exactly. So once he had his LVAD put in, at that time itself, he was with his fiance and he had been planning about this wedding, which he had been wanting to proceed through. But rightfully so, his fiance at that time said, you have to get better physically. So, I would going to wait for you, whatever time it takes. And so it had been building up for several months. And so it was so ironic. A week prior to his actual wedding, he had come for his follow-up visit to the clinic and said he was so happy finally that D-Day is coming and how he had thanked the Lord and his fiance at that time that she had waited for almost a year for this ceremony to happen. And the next thing I hear a week later, he's in the emergency room. And that's when I got the call.
And so his defibrillator shocked him 4 times. So he was in a medical emergency at this point, right?
Absolutely. And he was able to live because of his heart pump. And had he not had the heart pump, then he wouldn't have even made it to the hospital. So he was fortunate enough that he was able to seek medical attention because this heart pump was keeping him going at least until the time he could come and see us.
So let's talk about what's happening here. So the venue set up, we see some empty chairs that he would never get to sit in. And you couldn't stand the thought of your patient who had planned this wedding, who had worked so hard for it to make it happen, not to happen. And you jumped into action. Tell me What happened when you got the phone call that your patient was in your emergency room at Memorial Hermann?
Yeah, I was kind of taken aback because, just a week ago we had talked about the wedding and all the good things to happen. And now he's in dire straits in the emergency room, his heart rhythm acting up, and he had to have something done. So they were asking even if it's even feasible to go through the planned wedding because of his heart condition being so serious. I had a quick thought and I said, look, the man had been waiting for a year. So, whatever it takes, we should pray and try to see if it's medically possible to accomplish this. And for this to happen, it takes a village to raise a child. The same way the emergency room people were so kind enough, they said, we should do everything in our power. This is the time of duress. We should do something to make this thing which he had been planning for a year to happen. So, we planned and jump started his heart. And that's the time it all worked out because he got back to his God-given rhythm, and he still had a few hours left for the wedding planned, and the emergency room staff went above and beyond, and they said, you know what, we have come this far, we should somehow make this happen for him.
And this is them. They got married right there. His uncle was the pastor who made sure that this happened. So we see him here. And so I want to make sure everybody knows that with COVID restrictions, it's been really tough to get visitors. But this was at a time a few months ago when we had our lowest numbers, right? So you were able to get his fiance, soon to be bride, and his uncle up there on that floor to marry him.
Absolutely. The emergency room staff went above and beyond. Like I said, they were able to try to make room for them. And in spite of being emergency room, everybody accommodated. They were able to get the immediate members of the family there. And everything went as smoothly as possible. And it's a dream come true for the patient. And I was thankful to the Lord. And being part of this journey was something incredible for me.
Well, they got married there in the hospital, and then the bride was able to go to head out to the reception to meet up with all of their guests, and then he got to FaceTime from his hospital bed and basically be at his wedding, right?
Yeah, absolutely. This is kind
Incredible.
of an incredible event.
I think it's incredible that you realize that this is so much more than taking care of a patient. You had a life saving moment that you did for him as far as his heart was concerned, but then you saved his personal life as well. How important was that for you to be a part of something so much bigger than I'm just going to take care of your health right now? I'm going to take care of every part of your life.
Absolutely. He's been waiting for this for more than a year. His fiance was waiting for a year for this planned wedding. And, you can plan for sickness, you can plan for an event, but, you have to do everything out of your power to see if we can make this happen. And that's what was exactly in my mind at that time. He's gone through so many disappointments in his life. And, this comes the D-Day. We got to do something to make him feel that what he's looked for is going to make it happen.
And what was it like for everyone in the emergency room? We see him there and they're getting to kiss and they're getting to be together and they got to say their vows. I'm sure it was uplifting for everybody during a pandemic when we've had a lot of dark days, especially in the hospital emergency room.
It was truly uplifting physically, emotionally for everyone. It's been a rough several months in the emergency room, seeing difficult situations in the emergency room and seeing something, such sweet things happening really brought in, goosebumps into everybody's. And there was a purpose in everybody's life. It's not only taking care of patients from the physical perspective, but also from the emotional perspective. People have gone through thick and thin, but this is really what marriage is all about, trying to wait for that moment. And even if adversities happen, you say, there's going to be time and a place for that. And I really thank the Lord and all the ER staff. They went above and beyond to have this happen.
And before I let you go, because I know you are one busy man, when I first talked to you, I was so impressed with how I feel like we could bring in our entire audience right now. And that is, you were telling me how important you feel it is as us as a society to stop, to slow down, to do nice things for others, and how incredibly rewarding it can be for everyone involved, including yourself.
Absolutely. When you start the day's work, you go through difficult times, but you need to have good things happen to people around the society. Each one have to look out for oneself during these troubled times. marriage is that ultimate thing. If you're part and parcel of that happiness, that energy which you're going to get is going to be utilized in taking care of other patients. That's what this is all about. We all have to uplift one another during these dark times and try to hang around so that, good things are going to happen in future because of that energy which we derive from these kind of events.
I hope you have a blessed day. All right. Thank you, Dr. Nathan.
Thank you so much for having me again.
Okay, thank you. All right, Chaplain, let's talk to you. Thank you for joining us. Welcome to Lunch for the Soul. I want to talk to you about seeing moments like this and how uplifting it is, because I know that's part of your job, right? To help people during really tough times.
Yeah, so what's the question?
Oh, I was just asking you how important your job is in all of this, and you can explain to us how you and your team helps not only patients, but healthcare workers as well during tough times, especially during the pandemic.
Sure. Thank you. Thank you for asking me. Of course, before the pandemic, chaplains and Memorial Hermann, as well as other major healthcare systems in the country, have been focused on providing spiritual and emotional support to patients, families, as well as other healthcare professionals. And then, of course, with the stresses of the pandemic, the importance of that work has just been ratcheted up to a whole nother level. And, the surges have been the most difficult pieces of that, but the whole last 2 years has been a challenge on all of us.
I think it's so important for people to realize, if they're in the hospital or if they have a loved one in the hospital, to realize that you were there, and it can make a big difference in their lives to have the power of prayer put over to you. I know when I've had loved ones in the hospital, I would either go to the chapel, or even one of the pastors would come into my family member's room. Talk about a game changer as far as making you feel empowered, for relaxing you, for just giving you those moments of peace. But how do people find you? Do you reach out? Do they need to reach out to you when they're there?
Yeah, so usually the easiest way is just ask your nurse. Most nurses know how to get in touch with us. And in the case of Memorial Hermann Hospital, somebody is pretty much available to you 24 hours a day, either already in-house or on call nearby. And most of the time the nurse can get you connected with somebody in a very short amount of time.
Ever since the pandemic started, we have been calling healthcare workers our heroes, and they absolutely are. They've done so much selflessly to help us, to put their lives on the line to make sure we have ours. And they're just such a blessing to all of us. Let's talk about how you were able to help them. Have you been helping healthcare workers now more than ever in your career through the pandemic?
Yeah, absolutely. And, that takes a variety of forms. There are times when just integrated with our care for patients and families, we'll just take a moment at the nurse's station or in the break room and just give a nurse or a physician or some other healthcare professional an opportunity to debrief their day, and particularly challenging circumstances that they're facing. And then we also sometimes plan specific staff care events where we come in and provide a little extra TLC, some extra coping strategies for healthcare professionals to help them to face either a collective challenging experience that they faced, or just the baseline everyday stresses and strains of being a healthcare provider in the midst of a worldwide pandemic.
And I'm just wondering, for you and your team of chaplains there, how you have all dealt with it to protect yourselves, because it's not like you can just pop in a room now. Are you having to do all of the different care to protect yourselves as well?
Yeah, and when you say protect ourselves, I think of that in a couple of ways. Certainly when we go into a room with somebody who's got COVID or some other infectious disease, we wear the same PPE, personal protective equipment, that any other healthcare professional does. But then we also have to be careful to protect ourselves from the spiritual and emotional strains of being in the midst of this pandemic as well. And so self-care is important for us. We do a lot of taking care of each other in terms of fellow chaplains, to make sure that we understand that we're not alone, and that as we face these extraordinary challenges, that we can draw upon the strength that we have from our colleagues, our community of fellow professionals, as well as divine sources of strength.
Up. I'm really thankful that you did that, so that we can all keep you in our prayers, because we think of you all being the strong ones, and you just have this ever-ending power to give out to us in love and support and prayer, but not thinking about how you're human beings, and it drains on you to see that day in and day out. Let's talk about, for someone who has a tough time, finding that faith, finding that strength, going to a deeper place. Maybe they don't have a support system like you do. What do you suggest to people in that time? Because I really want to make sure people know that there's always help out there. There's always somebody who can help them. It's just a matter of finding it. And I hope we're able to do that for them.
Yeah, I kind of alluded to it in my previous answer. We all are going to face some extremely challenging circumstances in life, both personally and professionally. And we're not designed to cope with those challenges alone. And so what I would say is, connect with a chaplain or other source of help. And then we will help you assess, what are the resources that are available to you in your life, your beliefs, your faith, your community. And if need be, we will step in and be a part of that community, if even only for a season while you're facing hospitalization.
How much does it mean for you to work at Memorial Hermann, where it seems like so many of the doctors are doing everything they can above and beyond medical care? We introduced you earlier. You're on the tail end of that conversation. This lovely couple who got to get married right there in the emergency room because his doctor cared enough to make sure it happened. What does that mean to you?
It means an awful lot. I'm sure there are other fine healthcare organizations in town and around the country, but I've worked for Memorial Hermann for 19 and a half years, and I've just seen remarkable healthcare professionals from a variety of disciplines, whether the physicians like the one you interviewed before, nurses, respiratory therapists, social workers, physical therapists, just people from all different kinds of backgrounds that care deeply for others, and most of them voice a very, in their own words, their own language, their own belief system, a very strong sense of calling to do this kind of work.
Well, it's just beautiful to be able to witness firsthand, and I was just so in awe of that story, and I'm thrilled you're a part of that as well. I just want to ask you, because I think a lot of times people who perhaps didn't grow up in church, or they haven't ever really been taught that, and they don't understand it, that sometimes science-based information makes more sense to them. And I want people to know that there is medical study after medical study after medical study, and doctors will tell you, when you add prayer to whether it's chemotherapy or whatever medications you're taking, the stats show, and it's right there in black and white, the statistics show that those patients do better. How important is that for people to realize?
Yeah, I think it's very important. You're right. There's a large and growing body of research evidence that shows that when a person's spiritual needs are met, that it yields both positive physical and mental health outcomes. And then conversely, studies show when they are not addressed, that they have a detrimental impact on both mental and physical health. And so it's important. There's actually some research that's come out. Well, it's actually not been published yet, but I saw a pre-publication summary of it coming out of the Human Flourishing Program out of Harvard, and they are publishing recent research that shows that spiritual distress has a definite impact on psychological distress, and vice versa. And that's the important part of this study, is it shows that there's this kind of reciprocal impact in terms of how we're dealing with things emotionally and how we're dealing with things spiritually, that can have a downward or an upward spiral, depending upon what the circumstances might be in terms of our overall health and well-being.
Well, I hear doctors tell me all the time from them that they felt like they did all that they could and that a higher power came in to help heal a patient. And I just think that those testimonies really help people when they feel like they might not have a chance. It really can make a difference in their healing. Chaplain, thank you for taking time to talk to us today. Bless you for all you do for so many people day in and day out. And may your mental health be very healthy. Know that we are all sending you positive, beautiful vibes for all you do.
Thank you, Melissa. I appreciate it.
All right. And congratulations to Memorial Hermann for just an incredible journey that you've taken us on through this amazing couple. Have a blessed day. Thanks for joining us for Lunch for the Soul, everybody. We hope to see you back here every Wednesday, 12:30. It's the place to be.